Over 60? Drink this daily, and here's why it could help support healthy blood sugar and circulation. If your ankles puff up by evening, your legs feel heavy, or your fasting glucose sits stubbornly high despite diet changes, a simple bedside habit, one measured drink about an hour before you go to sleep, plus a short, practical nightly routine can make a meaningful difference in how your body handles fluids, electrolytes, and metabolic repair while you sleep. I'll show you the exact recipe, the timing, the step-by-step bedside routine to pair with it, and the safety checks you must do first. First, a short medical note. This information is educational and not medical advice. If you have kidney disease, take blood pressure medicines, diuretics, ACE inhibitors, ARBs, potassium-sparing drugs, blood thinners, or any diabetes medication, talk to your healthcare provider before starting any new supplement or electrolyte protocol. Monitor your blood glucose closely when you begin any change. If you're over 60 and want practical, clinician-style tips to try tonight, hit subscribe so you don't miss follow-ups, or the video we'll link at the end about the 3 common foods that damage vascular elasticity. Why a nightly drink can matter for blood sugar and swollen ankles. As we age, 2 linked problems tend to get worse: circulation in the lower legs and cellular hydration. Your calf muscles act like a second heart, pumping blood back up through the veins. When that pump becomes inefficient, fluid pools in the ankles and legs. At the same time, electrolyte balance, especially magnesium and potassium, directly affects how well your cells take up glucose and how well vascular smooth muscle relaxes. Better cellular hydration and improved microcirculation make tissues more responsive to insulin. In practical terms, that can translate to improved glucose handling over time. The drink I'll describe primes both processes. It gently shifts electrolytes, supports overnight kidney clearance, and sets up a low-inflammation nighttime environment where repair happens. Now the central piece, the daily drink and how to use it. The daily bedtime drink. Take about 60 minutes before your target bedtime. Ingredients and amounts as used in this protocol: about 12 ounces, roughly 1 pint, of plain water, 1 teaspoon of magnesium citrate powder. This delivers roughly in the range of a few hundred milligrams of elemental magnesium, depending on the product. Many sources estimate around 200 to 400 milligrams per teaspoon. Check your product label. And about a 1/4 teaspoon of cream of tartar, potassium bitartar, stirred in until dissolved. What this does: magnesium citrate is an absorbable form of magnesium that supports vascular smooth muscle relaxation, cellular energy chemistry, and healthy sleep-related repair. Cream of tartar supplies a small natural dose of potassium. When used together, they help rebalance electrolytes, assist the kidneys in clearing excess fluid between evening and morning, and can improve cell hydration. All factors that may help insulin sensitivity and reduce ankle edema over time. Timing. Take this drink about 45 to 75 minutes before your planned bedtime, so it's absorbed and starts to circulate during the early sleep period, when cells do most of their repair. Drink slowly over a few minutes. Don't gulp large amounts at once. Practical notes and alternatives. If you don't like the taste, add a splash of lemon. If you find magnesium citrate in powder form too strong, many people use chewable or liquid magnesium citrate supplements, but the absorption will vary. Do not substitute magnesium oxide for citrate if your goal is rapid absorption. Oxide is less bioavailable. Critical safety points about potassium and magnesium. Please read. This protocol gives you a small potassium boost via cream of tartar. Potassium can be dangerous at high levels, especially if your kidneys do not clear it well. If you have chronic kidney disease, low eGFR, or take potassium-sparing medications, for example spironolactone, or an ACE inhibitor or ARB, you must not add potassium without your clinician's approval. Hyperkalemia, high potassium, can cause muscle weakness, numbness, tingling, slow or irregular heartbeat, and in severe cases, life-threatening arrhythmia. Magnesium is safe for many people when dosed responsibly, but if you have kidney impairment, you may not clear magnesium efficiently. Symptoms of magnesium excess include diarrhea, low blood pressure, drowsiness, and in extreme cases, slowed breathing or cardiac conduction problems. If you take certain antibiotics or medications that interact with magnesium absorption, consult your prescriber. Before starting this drink, check a basic metabolic panel: serum creatinine, serum eGFR, serum potassium, and discuss the plan with your healthcare provider. If your provider approves, start with half of the suggested magnesium dose for the first week to assess tolerance, then consider increasing to the full amount if tolerated and cleared by your clinician. How this drink relates to blood sugar monitoring. The evidence that this exact drink will normalize glucose is limited and not guaranteed. The biological rationale is that improved electrolyte balance and sleep-related repair can favor insulin sensitivity. Some studies link adequate magnesium levels to better glycemic control. That said, the effect is typically gradual and variable between individuals. If you have diabetes, test your blood glucose before bed and first thing in the morning for several days after starting to detect any changes. If you're on insulin or oral glucose-lowering medications, do not change your dose without speaking to your prescriber. Now, the bedside routine that pairs with the drink. Think of the drink as the biochemical primer and the following 6 steps as practical mechanics that increase venous return, reduce overnight pooling, and support microcirculation, all complementary actions that together can help with fluid balance and metabolic function. Step 1. Contrast foot baths, 3 cycles. How to: warm water for 3 minutes, then cold water for 60 seconds. Repeat this hot-cold cycle 3 times. The hot water should be comfortably warm, not scalding. Cold water can be cool to brisk, but if you have neuropathy or poor foot sensation, use caution and consult your clinician before cold exposure. Why? Alternating temperatures provoke the local vascular pump. It encourages arterioles and venules to dilate and constrict, moving fluid and stimulating circulation in the feet and calves. This mechanical squeezing and release helps reduce standing fluid and primes the tissues to respond to the drink. Step 2. Legs up the wall active ankle pump, 5 minutes. How to: lie on your back with your legs up against a wall, or raised on a firm cushion if a wall isn't available. Actively flex your ankles. Point the toes, then flex back, at a steady pace of about 10 cycles per minute for 5 minutes. Focus on a full range of motion. Point hard, flex hard. You should feel the calves engage. Why? The calf muscles are the second heart. Activating them while gravity helps return blood, cleans out pooled fluid, and increases venous return to the core, improving overnight circulation. Step 3. Targeted venotonic topical massage, cypress plus rosemary blend. How to: mix approximately 5 drops of cypress essential oil and 5 drops of rosemary essential oil into 1 tablespoon of a carrier oil, like sweet almond or fractionated coconut oil. Warm a small amount in your palms, then massage gently from the ankle upward along the calf toward the knee, and then toward the groin, always upward toward the heart. Use light to moderate pressure, stroking in the same upward direction for several minutes per leg. Why? Cypress and rosemary are traditionally used as venotonics. They may stimulate local circulation and provide a tightening sensation to capillaries. Topical massage also mechanically moves fluid toward the lymphatic and venous drainage pathways. Safety: perform a patch test first. Stop if you experience skin irritation. If you're on blood thinners, check with your clinician because botanical extracts can interact or increase bleeding risks in rare cases. Step 4. Low-grade nighttime compression, 8 to 15 millimeters. How to: use travel-grade compression socks or light compression sleeves rated around 8 to 15 millimeters while you sleep. Do not use medical-grade high compression stockings overnight unless prescribed by a clinician who has evaluated you. Why? Gentle compression helps maintain the gains from the bath, pump, and massage by preventing fluid from recollecting in the ankles while you transition into deeper sleep.
Safety: avoid tight or improperly sized hosiery that leaves deep indentations. If you have peripheral arterial disease, severe neuropathy, or an active wound, seek medical guidance before using compression. Step 5. Stop large fluid intake 3 hours before bed. How to: make your last substantial drink about 3 hours before bedtime. Small sips are fine if thirsty, but avoid heavy fluids right before sleep. Why? The kidneys clear excess fluid more effectively when there's a gap between the last intake and sleep. Giving the kidneys a window to process fluid reduces the amount that lingers and pools in the legs overnight. Step 6. Nighttime vascular repair supplement, optional, clinician guided. How to: as an optional add-on under a clinician's supervision, some people use a vascular repair combination at night. Horse chestnut seed extract standardized to aceine, as used in vascular support protocols, often in the 100 to 300 milligram range. In this protocol, we reference a commonly used dose around 300 milligrams, paired with a pine bark extract, pycnogenol, around 50 to 100 milligrams. Take these at bedtime as part of the evening routine if approved by your healthcare provider. Why? Horse chestnut and pycnogenol are used for capillary integrity and microcirculation support. Taken at night, they may support tissue repair when circulation and cellular maintenance are most active. Safety and interactions: do not take these if you are pregnant, breastfeeding, or on anticoagulant therapy without medical clearance. Horse chestnut products can contain coumarins and may interact with blood thinning medications. Pycnogenol may also alter platelet function in some people.
Always obtain these supplements from reputable suppliers and confirm dosing with your clinician. Putting it all together, the practical nightly flow. About 60 minutes before bedtime, mix the magnesium citrate and the small cream of tartar dose into 12 ounces of water and sip it slowly. While it's absorbing, do your contrast foot baths. Hot 3 minutes, cold 1 minute, 3 cycles. After the baths, lie down with your legs up and perform 5 minutes of ankle flexes. Follow with a 2 to 3 minute upward massage on each calf using the cypress rosemary blend. Put on your low-grade compression socks if advised, and make sure you've stopped large fluid intake roughly 3 hours before bed. If your clinician has approved the vascular repair supplement, take it now. Go to bed and monitor your symptoms in the morning. Start slowly and monitor. Begin this routine on 3 non-consecutive nights the first week to assess tolerance. Start with half the magnesium dose for the first 3 to 7 nights if you're unsure how you'll respond. Keep a simple log: pre-bed glucose, morning fasting glucose, any swelling score, scale 0 to 3, and symptoms like muscle cramps, palpitations, or lightheadedness. After 1 to 2 weeks, compare trends and discuss them with your clinician.
If you're diabetic, it's particularly important to monitor blood sugar more frequently during the first week, pre-bed and first morning fasting readings for at least 5 to 7 days. Report any unexpected hypoglycemia or significant glucose variability to your care team. Do not lower or stop diabetes medication on your own. Who should not try this drink and routine without medical clearance? Anyone with known kidney disease, low eGFR, or on dialysis, people taking potassium-sparing agents, ACE inhibitors, ARBs, or chronic NSAIDs without clinician approval, anyone with a history of cardiac arrhythmia without cardiology input. Those on anticoagulant therapy should consult before adding horse chestnut or pycnogenol. Individuals with severe peripheral arterial disease or severe neuropathy should seek vascular or podiatric assessment before contrast baths or compression. Common questions and practical troubleshooting. Q. I'm on a diuretic. Can I still try this? A. Diuretics change both potassium and magnesium handling. Loop and thiazide diuretics often cause magnesium loss. Potassium-sparing diuretics increase potassium. Discuss with your prescriber and get baseline labs. If approved, start with a lower magnesium dose and very small or no cream of tartar until labs confirm safety. Q. What if I get diarrhea from magnesium citrate? A. Magnesium citrate is osmotic and can cause loose stools in some people. Reduce to half a teaspoon or switch to a divided dose. If diarrhea persists, stop and consult your clinician. Persistent diarrhea itself can disrupt electrolytes and glucose control. Q. How long until I see results? Expect subtle improvements over weeks rather than overnight miracles. Some people notice less evening swelling within a week, while metabolic markers like fasting glucose may take several weeks to show consistent change. Consistency matters. The routine leverages nightly repair, so do it most nights. Q. Is cream of tartar the only potassium source? No. You can get potassium from foods, bananas, potatoes, spinach, and from prescription supplements. Because cream of tartar is a concentrated, non-standardized source, it's best used only with clinician approval. If your provider prefers, they may recommend a measured oral potassium supplement or dietary adjustments instead. Q. Can this replace my diabetes meds? Absolutely not. This routine is supportive and complementary. It is not a substitute for prescribed medications. Never stop or change your medication without professional oversight. A few practical shopping and dosage tips. Look for magnesium citrate in a labeled powder with clear elemental magnesium info. Many products give elemental magnesium per serving. Use that to match the approximate range discussed here. If the label is unclear, ask a pharmacist. Use a calibrated teaspoon or small kitchen scale if you want precise measurement. If you prefer tablets, calculate how many milligrams of magnesium citrate each tablet provides. The spectrum of absorption and onset can differ. Choose travel or mild compression socks labeled 8 to 15 millimeters mercury for overnight use. These are widely available online and in pharmacies. Avoid high compression medical stockings unless fitted by a clinician. Signs to stop the routine and seek care. New or worsening palpitations, lightheadedness, muscle weakness, numbness or tingling. Refractory or worsening swelling despite routine adherence. Severe abdominal pain, persistent diarrhea, fainting, or chest pain. If any of those occur, stop the supplements immediately and contact your healthcare provider or emergency services as appropriate. Why this combined approach is more likely to help than a single tip. Many seniors treat surface symptoms, elevate your legs in a chair, reduce salt, or wear compression in an ad hoc way, but those tactics often miss the metabolic and electrolyte drivers beneath the symptom. The drink gives a predictable, measurable electrolyte signal that affects cellular hydration and vascular tone. The contrast baths, muscle pump, massage, and gentle compression provide mechanical facilitation of venous return. The timed fluid fast lets the kidneys do their job before sleep. The optional vascular repair supplements support capillary health while tissues are in repair mode.
Together, they create a nightly window where the body is more likely to clear excess fluid and support insulin sensitivity. A realistic expectation and final safety reminder. This is not a cure for diabetes. It is a practical, clinician-framed routine you can try nightly that may help support healthy blood sugar regulation and reduce leg swelling over time when used alongside your standard medical care, diet, and exercise. The effects are likely to be modest and gradual. They rely on consistency and proper medical oversight. Before you begin, get basic labs, kidney function and serum potassium. Discuss the plan with your clinician and set up a short period of closer glucose monitoring so you and your healthcare team can detect any meaningful changes. Recap: 1 simple nightly drink and a 5 to 10 minute bedside routine. Drink about 12 ounces water with 1 teaspoon magnesium citrate powder plus a 1/4 teaspoon cream of tartar, taken about 45 to 75 minutes before bed. Start at half dose if uncertain. Check labs first. Routine: contrast foot baths, hot 3 minutes, cold 1 minute times 3, 5 minutes of active ankle flexes with legs up the wall, 2 to 3 minutes of upward calf massage using cypress and rosemary diluted in carrier oil, light compression socks 8 to 15 millimeters mercury if appropriate. Stop large fluid intake 3 hours before bed. Optional night supplement: horse chestnut seed extract, standardized to ASIN plus piconogenic, only with clinician approval. Monitor. Check your pre-bed and fasting morning glucose for the first week and report any symptoms of electrolyte imbalance to your clinician. If you try this, keep a short diary for 2 weeks. Note your nightly routine adherence, evening swelling scores, any changes in your morning fasting glucose, and any symptoms. Bring that log to your next clinic visit so your clinician can help interpret the trend and adjust your care safely. If you'd like a deeper dive into what foods specifically harm vascular elasticity, the very things that work against everything in this routine, watch the next video on 3 common foods that damage vascular elasticity. Try this routine responsibly, monitor closely, and work with your healthcare team. Small, consistent changes at bedtime can add up into real improvements in circulation and metabolic health over time, especially when you are over 60.